All right, so today we're here with John Shoup, and John's been a patient of ours for, gosh, we just finished up your first 4-month treatment program.
Indeed.
And we were just reflecting on, your initial intake paperwork earlier, and it was, sometimes we forget how bad stuff really was in the beginning. So,
Absolutely.
You know what, just let's go back to the beginning about really what brought you in, why you were here, what you wanted help with.
What brought me in was, it all started with a panic attack and just physical discomfort 3 years ago.
Mm-hmm.
And gosh, for 2 years or
Mm-hmm.
yeah. So I had just after that, nothing came about that. Just
Right,
went
you
to
went to
the
the
ER.
emergency room,
Yeah.
got a huge bill.
Huge bill.
Yeah.
All for nothing.
Yeah.
So after that, just more anxiety,
Mm-hmm.
more physical discomfort,
Mm-hmm.
and then just seeing so many different doctors.
How many different doctors do you think you've been to?
So like general practitioner, just, going to those places,
Mm-hmm.
at least 3 different doctors there.
And what were they telling you?
They were telling me that it was the anxiety. They were like, okay, so the anxiety, they're like, you just need, antidepressants. It's all in your head.
Yeah.
Even when I would bring up the physical problems.
Mm-hmm.
So, yeah. Anyway.
So they gave you some prescriptions, and
Yes.
did those help you, or where were
No,
you at
they
with
did
that?
not. Yeah. So,
Okay.
so I'm continuing to go
Mm-hmm.
to these doctors, like multiple visits to the same doctors. But
Right.
then even some specialists. Sometimes I saw, oh gosh, it wasn't a stomach guy.
Mm-hmm.
I was supposed to see a stomach guy. I saw somebody. I got the MRI
Mm-hmm.
done because of stomach pain that was
Right.
going on, and then they just told me acid reflux. So
Okay.
I thought, oh well, acid reflux. Maybe that's.
So they put you on some Nexium or Prilosec or something like that?
Nexium.
And did that help?
No, I think I was trying to believe it. You know what I mean? And I was like, oh, this is working.
Right.
It wasn't. So just after all of this, and then after all that time, in your head, you're like, it's just you want answers.
Right.
So it's a lot of frustration, and
You were lucky enough to have some family members
yes,
who
my mother
had
and
been here
sister
before. So
were here. Yeah,
maybe gave you a little bit of a push.
100%. Yeah.
Okay.
When they were struggling with similar things, my sister, and you just never really consider
Right.
diet and stuff when you're, I didn't, at least. It just kept happening,
So one of the awesome things is that when you came in, we had started with doing our neurofeedback program at the beginning of last year in January.
Yes.
So when we did your consult and whatnot, based on you were having the anxiety, a lot of the complaints you had were really very like emotionally based.
Yes.
So part of your treatment was we did 20 sessions of neurofeedback. We also looked at your blood work and did a lot of metabolic type testing to find out the underlying root cause of what exactly was going on. So flash forward, we've gone through your 20 neurofeedback sessions. We've looked at all your tests. We've done the things that we need to do for that. And what's your life look like today?
All that time not knowing and not knowing what to do and never having dealt with anxiety previously in my life. For 27 years, something like that. You just feel like you're trapped. You don't know what to do, and you're trapped and stuff. So it sounds dramatic, but it is dramatic. It's a dramatic change. So it's almost like it's a complete 360 as far as physically how I'm feeling. And then because of the physical, taking care of this, that, it led to so much less anxiety,
Right.
Which is, the anxiety really was like a...
Well, it was getting to
big
the point where you
obstacle.
weren't even able to go to
Correct.
work. or you had your
I
hours
left
reduced a
work,
lot.
like 3 or 4 times I had to go because
Right.
of just a really gnarly panic attacks.
Yeah. So what did you talk a little bit about the neurofeedback? Because, a lot of people aren't really familiar with that. Was it, I guess when people look at having someone set up on that, it looks like it might be uncomfortable or anything like that.
The thing.
The brain map can sometimes, just being in the hat's a little snug.
Yeah.
But I mean, as far as the training goes.
Yeah, it was cool. I mean,
how soon after we started with you on your program did you notice less anxiety and that you were feeling better?
It was maybe like a month into it. It wasn't too. It didn't take very long. When I'm switching up the diet completely. So I was, drinking all sorts of coffee and sodas and all, you know what I mean, and just cutting all that stuff out. And because of that. Yeah, the anxiety just I still had them. Still had to take the medicine every once in a blue moon, but just not even close to how often. It was at least once a week I was taking it at work, having to do it at work mostly.
How much relief do you feel like you've had from you had a myriad of symptoms. You had a lot of pain, you had stomach issues, you had this anxiety, panic. Overall, if we looked at all of those things together, how much better are you from when we started? On a scale of 0, no improvement, to 100% would be 100%.
Oh, 100%, I think. Maybe 98.
Okay, close.
98, yeah. Because, total transformation of from where I was to now, completely, yeah. So, the symptoms were, when I told people, and that's when I told doctors and just people I worked with, they don't, no one is buying what you're saying, because, so then you almost feel like, oh, maybe it is my head. So,
maybe I'm just crazy. That's what you're going to say.
Exactly. I'm just crazy because there were just so many symptoms.
So what we found then was, you have, a positive IgA that we see with celiac patients for transglutaminase 2. So that can carry a lot with it as far as emotional type symptoms, whether that be anxiety, bipolar, even schizophrenia. You have a higher rate of that. So we know that that's an issue for you.
Yep.
And now you know that it's an issue for you. So when we put all that together, the awesome thing is when you can do the metabolic part of it and you're giving the brain good fuel, you're not putting things in there that create inflammation in the body, and you can correct the dysregulated brain patterns, because you had a lot of overfiring in certain areas that we see with people with anxiety.
Yes.
So when we're handling it from both sides of the coin, you really do see pretty significant results, and it doesn't really take that long. A lot of people feel like if you have anxiety or depression that you have to go sit on a couch somewhere and talk to someone about your issues. And, 10 years later, you're sitting on the same couch talking about the same thing and no one's getting anywhere. So, this is transformative. And when we did your progress tracker and looked at, every day when you would come in to train, we would have you fill out a progress tracker. So when we looked at that from beginning to end, easily, I'd say 50% in most things and a little bit more on others, as far as the symptomatology that you started out with and that we saw in the end. So if someone were suffering with a similar issue and you had a bunch or a laundry list of things, anxiety, panic, digestive, would you recommend this type of treatment for them?
I would 100%. It was years. So, a few years of just not knowing, and
that gives you anxiety.
So it spawned anxiety, just not knowing. And so these things can be created out of, just out of not knowing. And all these physical things. And so coming here, and then the metabolic, so it's tying into the, the mental part of it all. And, having gone through it, 100%. I don't have the anxiety as much anymore. Look, that keeps you away from everything. It will. Not everybody, but it can, and it did with me. And I know there's people out there that are they're scared about that stuff. They're afraid of, you know, am I ever going to leave the house?
You are correct.
Yeah.
Because that's kind of the point where you were getting to, where you were isolating yourself.
Yeah, I just became, I would stay in my room.
Wow.
And have to, you know, take the medicine and maybe sleep and stuff. And I'm not big on, you know, sleeping the day away. I'm not,
Sure.
I wasn't until, you know, it comes along.
Mm-hmm.
So, yeah, I mean, you're going to have people who are listening to you for finally, you know what I mean? And that's really, like, that's one of the biggest things, is just not to take away from any of these other doctors. I mean, look, they're doing, I guess, what they're, you know what I mean? Like, what they're supposed, I guess. But it's just
what they're trained to do.
What they're trained to do, yeah. So, I mean, if you got a cold, go ahead, go over there. But, you know, otherwise, when it's something, it's extreme. For me, it was a big deal.
Sure.
And if you're feeling that way, I think you should 100%, because there's, I mean, again, it's just really like somebody finally, it's like, man, somebody knows what they're talking about, and it is a big deal to find you guys and the help. I mean, just listening and caring about it. So
the awesome part is that you'd already had the groundwork laid by some family members, so they were already kind of giving you the push.
Yeah.
But
cool,
and you were great because you were here for your appointments. You did what you were supposed to do, and that makes all the difference. So, you know, as your partner, I appreciate your help in getting you well.
Thank you.
And I'm really stoked for the fact that you're feeling so much better and that you can go out and begin to enjoy your life again. So, good stuff. All right.
Absolutely.
Thanks, Sean.
Thank you.